This is the case of a 7-year-old girl who presented with ventricular inversion and double outlet right ventricle. She presented in infancy with cyanosis, and since it's a complex correction, underwent a PA banding. Now she presented at 7 years with 60% saturation for total correction. She underwent a Senning with LV-to-Aorta baffling and Confluence plasty. This is a 3D VR rendering of the cardiac CT. We are preparing the specimen by removing all the skeletal structures, and that's the right atrium connected to the left ventricle. This is the right ventricle that gives rise to both great arteries. That is the aorta and the descending aorta. This is the PA banded area. So now by removing the descending aorta, we can expose the branch PAs from posterior. So that is the left pulmonary artery, which ostium is stenosed. That's a right pulmonary artery. That's the confluence, which is stenosed, which has to be repaired. So we are loading the vessel view, and we are sectioning coronally and we've entered the LV, and we are seeing the VSD from the LV side. It's marked in green now. And we are now sectioning from below, and then we'll enter the RV from below. And now we can see the outflow tracts. The left ventricular outflow tract is being marked in red now. And there's the coronal septum to the right, and this is the right ventricular outflow tract marked in blue. So we are sectioning from the apex. We can see the anterior left ventricle, and you can see the marked structures. The green is the VSD. And now we are creating a baffle, and we are suturing it to the margins of the VSD and the LVOT. And since it's a complex baffle, the waste formed by the baffle can result in narrowing of the LVOT, which can be visualized both from aorta and from the VSD side. So to prevent subaortic stenosis, we need to contour the patch a bit more liberally, and we are doing this by expanding the patch. And once expanded, when we review the LVOT from below, you can notice that the patches, the LVOT has widened. And even from the aorta, you can see a straight path to the VSD. So when you section out and isolate just the VSD patch, it's seen as almost like a semi-tube. That's the location of the bundle.